All right, this is the press conference from the hospital where the Ebola patient is in Dallas. I'm not going to play the entire thing. I just kind of made some clips for some highlights. So I'll play the clips and then give my 2 cents on what these guys are saying.
Thank you for coming to visit with us today. The Federal Centers for Disease Control has confirmed that a patient admitted to this hospital has tested positive for Ebola virus, the cause of Ebola virus disease. The hospital has been and is following all the CDC and the Texas Department of Health recommendations to protect the safety of our patients, our medical and other staff, volunteers, physicians, and visitors.
Texas Health Dallas has a robust infection control system, and our staff is trained and prepared to take care of patients with a variety of infectious diseases, including Ebola virus disease. An epidemiologic emergency policy is in place at the hospital, and infection prevention and emergency management are working closely together to stay abreast of ongoing developments. The hospital is operating as normal, with clinicians caring for patients and other hospital employees supporting those caregivers as they do every day.
The patient has been in appropriate isolation, which according to CDC is called contact isolation and droplet precautions, since they arrived for this admission on Sunday. Our staff is thoroughly trained in infection control procedures and protocols, and we have been meeting literally for weeks in anticipation of such an event.
So that just goes to show you that the CDC and the medical community, they know this is going to spread. They know it's not going to stay in West Africa. If this hospital has been preparing for weeks, all hospitals have been preparing for weeks. Now, they may say they're ready for it. They have no idea what they're dealing with. This disease is vicious and it spreads very easily. And you'll see later on in the press conference, it almost makes me sick, the answer that he gives to how the doctors treating the patient are dressed. They're not in spoiler alert, they're not in that head-to-toe bodysuit that we've seen in all the pictures. So basically, they're walking dead. I hate to even say that, but they're walking dead.
Doctor, why did it take 48 hours after this patient initially sought care to then be put in isolation?
Well, the patient's initial visit was 2 days before, when they presented with very nondescript, nonspecific symptoms, and it was not clear that the patient had come from an area where Ebola virus was present.
So in all those weeks of training that you were conducting, I guess it wasn't on your radar to have your screeners ask if people presenting with fever and nondescript symptoms had been traveling to West Africa recently. And it gets even worse. This patient is from West Africa. He's not American. So there's no excuse. It's not like, some white kid walked in and just had a fever. This is an African. He would have a Liberian accent. To not ask where you came from, how long you've been in the country, it's incompetence. Been training for weeks. For what? To not ask if the person traveled to Africa?
When did you first learn that the patient had come from West Africa?
On the second visit, which was Sunday the 28th, that's when the information became more clear. But even then, it wasn't completely clear, and it's still evolving. We're getting newer information as each day goes on.
How many people do you think might have been exposed to him during that time when he was contagious? The CDC said just a handful of people, but wouldn't he have been around a lot more people than that just in the hospital?
Well, I can't speak to the people outside of the hospital, but from what we're determining, and we're looking at all the people who might have had contact, there doesn't appear to have been any significant exposure, because only exposure requires exposure to blood or body fluids, and at the time of that visit, he wasn't that ill, he wasn't having body fluids, he wasn't having vomiting or diarrhea.
So there's no concern about any hospital workers?
Well, I wouldn't say there's no concern. We're certainly going to track all the people who had contact with him, and we're going to watch them and monitor their health.
And does that include hospital workers?
Of course.
anyone who's ever been to a hospital knows that there are dozens, hundreds of people walking around, especially in an emergency room. Staff, patients, people coming in, going out, maintenance workers, sanitation, the whole deal. It's nonstop hustle and bustle the whole time. Now, again, I don't know if it's arrogance or just ignorance about this, since no one's ever seen this in this hemisphere before. But to say that it only travels by blood or urine or diarrhea or whatever, true, it does travel that way. And also, if the guy coughed on his hand at any point, and then that hand touches his shirt or touches the sheet of the bed that he's on, and then that brushes against somebody else, now they have the virus on that. If he has a fever, which it sounded like he did, he came in an ambulance, you'll hear later, he must have been sweating. There's Ebola in the sweat. So, it just, if they're only looking at a small number of people that they're worried came in direct physical contact with him, they're not looking at enough people.
Doctor, can you tell us about the facility that the patient's being held in right now? Is it structurally separated, everything from air to power to what?
Well, Omar, first of all, let me say that it is not an airborne disease. So there's no requirement for separating the air. However, he is in the intensive care unit, not initially because he was that critically ill, but because it had the negative air pressure in the event that we needed that kind of isolation. And secondly, it has glass walls that we can look in. And one of the tenets of proper personal protection is that the people caring for the patient have a buddy watching them to ensure that they're doing all the things proper for their own protection. It happens to be a segregated area away from any other patients by convenience, and we have put restrictions so that there's no traffic coming through that area. It's an ideal location, in fact.
Doctor, how are the doctors and nurses who are treating this patient dressed? Is it similar to what we've seen as footage in Africa, where they are dressed head to toe in protective clothing?
The head to toe is not an actual requirement. But in Africa, it might be because they have such primitive resources in terms of running water, floors. They often are on dirt floors and such. What the staff are doing now is they're wearing water-impermeable gowns. In fact, they're wearing two of them because the gowns open in the back and it's hard to tie them closed. So they have one gown that's in the back and the other gown tying in the front. They're wearing gloves. They're wearing surgical masks, and they're wearing eye protection. And they're wearing, because the patient did have diarrhea, they're wearing shoe protection as well.
Where to begin? Yes, it's not a requirement, I guess, apparently for some unknown reason, that you don't have exposed skin when dealing with Ebola patients. So, they have goggles on and a surgical mask. A surgical mask won't protect you at all. It's well known that it doesn't protect down to that level of microscopicity. It's probably not a word. But it won't protect against a virus that tiny. It'll go right through the mask, a surgical mask. Are you kidding me? 2 gowns and gloves and booties is all these workers have to protect them against this highly contagious, deadly virus. So if that's the only protection they have, like I said earlier, Walking Dead. In 2 weeks, these people are going to have symptoms, and I'm hoping they're not treating other patients as well, that they're only dealing with this guy. Because if they're going from here, getting decontaminated, and then going into the rest of the hospital and dealing with other patients, my God, come on. So let's keep going with this news conference.
Do you know why this patient was in Liberia?
I do not know the details. I believe this is where the patient lives, and he was living and working there.
Do you know why he's back in Dallas?
I'm not certain yet. I think he's here to visit family.
Doctor, do you have a time estimate on when the patient may have contracted Ebola based on your study of this patient now?
We only know that he apparently arrived here, I believe, on the 20th, in the United States, and his symptoms did not begin until about the 24th. That's the best estimate we have. But like I said earlier, some of that information is changing the more we get information from him and his family.
So to recap, the guy got sick on Wednesday, the 24th. So all day, Wednesday, Thursday, went to the hospital on Friday, was apparently, oh, you have a fever, don't worry, drink fluids, go home. Sent home. Saturday, Sunday, taken by ambulance back to the hospital. So he had Wednesday, Thursday, Friday, Saturday, Sunday. Infectious to infect anyone and everyone that he comes in contact with. Anything that he touches, anywhere he goes, anywhere near him is infected.
Describe all the measures you're taking to first find out who may have had any sort of hazardous contact with this patient in the first 2 visits. Just everything from figuring out who might have been there to from staff to janitors to doctors, all the things you're doing to make sure that there aren't patients that may be, or that there may not be people that came in contact with the patient.
Well, first, we have an electronic medical record which facilitates the tracing of individuals who had participated in the care of a given patient. So we have access to that. Secondly, we communicate through the leaders in a given department, and they can talk with their specific members. So, for example, the nursing leadership can talk with the nurses to make sure that there anyone that might have had contact with this patient. Those steps are already underway.
What about fellow patients, doctor? Has there been any effort to track down fellow emergency room patients?
The emergency room has a log of patients, and that log will be looked at. But remember, this is not transmitted by the air. So the only contact that would be at risk would be someone face-to-face touching their blood, their body fluids, or getting a needle stick. So other patients really shouldn't be at risk.
Doctor, what kind of...
When he went to the hospital Friday, said he walked in on his own. I'm assuming that he touched a pen to sign something, that he sat in a chair in the emergency room and had his hands over the handles. Contamination. You don't have to be giving the guy an IV to be contaminated. It doesn't travel through the air technically, but it can live outside the body. And these people seem to be missing this very, very important point. If the guy would have had it on the outside of his clothing, as he's just walking around, especially if he's sweating, it would be all over him. So it would be all over this hospital. They need to decontaminate the entire emergency room from Friday. But it's already too late because people, hundreds, I'm sure, maybe thousands of people have been in and out of that emergency room Friday, Saturday, Sunday before they finally got this guy back in, brought in by the ambulance. So in 10 days or so, we're going to find a lot more people coming down with nondescript symptoms going to emergency rooms here and there. And if they treat those patients like they're treating this patient, it's going to be lights out. I hate to say it. Well, we all kind of knew this was coming when we saw how bad it was in Africa. It shouldn't be a surprise, and these people's nonchalance towards this also shouldn't be a surprise. It's very disappointing, and as much as they say that they're taking it seriously, their actions are not backing up their words.